Hi everyone. Yes, after a long time, this we are waiting for this MCQ session. As I said, so we are going to launch the MCQ session here. From every day we get 5 questions, at least minimum 5, and maximum 10 questions. Special MCQs for preparation for AIIMS NORCET and as well as DSSSB. So, by beginning of the sessions, I would like to share some of the few questions which are very important for your competitive exams. You get an idea how to approach the questions and how to eliminate the options. Option कैसे eliminate करना है, दो option, as well as how to go for the right answers. So we are going to complete with rational and with explanations, right? Yeah. So let us move on to the first question. Yeah. The nurse receives the call. The client is being transferred from the post-anesthesia recovery unit to the floor. What should the nurse do first when arrives? So this is the basics. So why I am giving the basics? If you see, you have to analyze yourself. You are studying the basics or advanced level. So what you feel, क्या feel इसमें जो है question? This is very simple, basic. So everyone can answer. So if you are in the clinical side, if you are in recovery room, if you are in OT, so what you do when you receive the patients? So first thing, what usually we do, option A, they give the assess the patency of the airway. Option B, they given assess the drain in the client for the patency. Option C, they have checked the dressing for the bleeding. Compare the vital signs with those in the post-anesthetic care unit. So post-operative care, PECU. So when you are in the PECU, you know that PECU, post-anesthetic care unit. When you are receiving, imagine that. So there is a tricks which you follow in your competitive exam. You be in that situation. So you are in that situation. So how you go and approach the question? So if you are in that situation, so if I'm there, I'll go for this first options, assess the patency of airway. So airway patency is always important. How you give the patency of airway? That's a rational which you should know. How you give? By placing the patients in the positioning, best positioning, which recovery positioning usually we give. Left lateral recovery positioning we give when we receive the patients with the side lying, the neck side lying with recovery position. So because to prevent aspirations as well as the patient's airway will maintain in a proper way. So by this option we go for option A. So patency of client airway is most critical. Without if the client cannot survive. So that is a preference here. So option A is the right answer. So next question, the perioperative nursing, we go for during the extended post-operative period after an abdominal hysterectomy. The nurse notes a urine output of 20 ml per hour. So what does it mean? So post-operative always important urine output. So urine output is very important. And moreover, this is the extended post-operative. You have immediate post-operative, you have intermediate post-operative, you have extended post-operative. Extended with last, maybe after 7 days, you can tell. Extended post-operative, what you are going to do. And urine output is 20 ml per hour. This is also comes under basics. So basic level, moderate level. So this knowledge you should know, basic, moderate, and advanced level. Whenever you prepare for the competitive exam, you divide the questions, the basics, moderate, and advanced level. So this, if you know to analyze the basics, moderate, and advanced, that is more than enough that you can easily able to crack. Because why I tell this is the basics. So everyone knows that post-operative urine output, normal urine output is 0.5 ml per kg per hour. Post-operative. So in the book, if you see, they given 30 ml per hour. Let us practice with the formula 0.5 ml per kg per hour. So this is what actually direct questions. Option A, they given, consider this as a normal. Evaluate the client's fluid intake. Prepare the client to return to the operating room. Consult the urologist. So there is no confusion here. Yes, what first thing the students usually we go for confusion within, there may be having problem in the urine output. Better we can go and consult the urologist. Some confusion will be there. Option B and C will be the confusion usually. Yes, you can go for the urologist before that assessment. You have to evaluate, assess the patients. You intake whether patients having proper intake or not. So better go for the patient's evaluation. So it's for me, it's a good right. B answer is the right answer. Evaluate the client's fluid intake. So by the several day out of surgery, the intake and output should be equal. So first thing to do the assess the client's fluid intake before consulting. This is what nurses will do. Okay, we have to do clinically. We see, as I said, you are be in that situation. So if you are not able to answer, be in that situation. You are in that department, post-operative department. So what do you do? Then you get an answer. Sometimes what happens, we get confused when you are answering for the elimination pattern. So that time, imagine you are in that situation and think what you do. That may be the right answer. Then the hypertensive patients presents to the emergency department with wheezings and bronchospasm. He has just placed an antihypertensive medications. What medications should like to be started? So it's a very important question as well as it's a direct question. Okay. So option A, we have nifedipine. Option B, we have chlorothiazide. We have propranolol and we have guaifenesin. So I think this we can consider. What I will do, this we can consider moderate level question. So this level, how I said this is moderate. You see the analyzing. You see analyzing the capacity. This is the moderate level question. Why? This is not a basic, because if you are not knowing the antihypertensive medications and classification, what is calcium channel blockers, what is beta blockers, and what is thiazide diuretics. So this all the classification you should know. And moreover, the question is hypertensive patients with wheezing and bronchospasm. So usually we give hypertensive patients beta blockers, but the question is here they give wheezing and bronchospasm. That is the reason why in the wheezing and bronchospasm, beta blockers are contraindicated. Usually beta blockers are contraindicated, but not all the beta blockers are contraindicated. So usually if you go and study in the book and everywhere, they given beta blockers are contraindicated, beta blockers are contraindicated. But here selective beta blockers we can use. What is that? Selective beta blockers we can use. What is that selective beta blockers? We can tell metoprolol. So this is the question here. So many of the book they have given generally beta blockers are contraindicated, but you should know selective, non-selective beta blockers. Selective beta blockers, metoprolol, which is very important. Non-selective beta blockers, you have propranolol and atenolol, lebetalol. Sorry, lebetalol. So lebetalol, propranolol usually you should not give. So this won't be given. Thiazide diuretic is not needed because of bronchospasm, and which is the safer drug we can tell the safer drug. So which is very important. It just placed on anti-hypertensive medication. Wheezing and bronchospasm is there, so we can go for which medication mostly like to be started. So mostly like to be started is your, what do you feel? Calcium channel blockers, nifedipine. Okay, beta blockers should not be given. Okay, and thiazide diuretic is a secondary anti-hypertensive drug, so we can consider, but primary is nifedipine. Okay. Yes. So thank you so much. Yeah. For more MCQs, please subscribe our channel. Yeah.